You have to do the work. Mr. Nangwe, these are your folks, and this is your sister that went to Liberia and did well for us there.
Yes, Ms. Simmons, welcome. Ms. Tyler, welcome again. And let me thank you all for all you do, especially Ms. Simmons, taking your time and going to Liberia to help out. Much appreciated. Thank you also, and welcome to the show. Did you say you've been teaching for 57 years?
No, I taught for 27 years. I've been
27.
nursing for 57.
You did nursing for 50. I thought that's what I heard. Yeah. You
Yes.
did nursing for 50. Well, thank you so much. The nursing profession is is pretty demanding, and again, it's a life-saving engagement, so thank you very much for all that you do. Ms. Tyler, did you introduce yourself yet?
Now,
I
officially,
did.
now
You were
go
off.
ahead. Now,
I did.
officially, you can go ahead and do it because we were freezing when you were talking.
Okay.
Tyler, go ahead.
I think she's
Okay.
frozen. Oh, okay.
Can you hear me? Okay.
Yeah.
Once again, my name is Abby Tyler, Abigail Tyler. I am a nurse practitioner, family nurse practitioner. I was a nurse for about 22 years, cardiac nurse, and also worked in long-term care and agency, and now work as a nurse practitioner. I worked in primary care before, is when you go to the clinic and see the doctor there. Now I work as a hospitalist, which is like clinical nurse practitioner in a nursing facility. I take care of the people there for their current illnesses. Also, talking about education, I'm certified RN preceptor, so I taught dozens and dozens of new nurses when they came on, and also I also a preceptor as a nurse practitioner too. So I just had a nurse practitioner student that was still in school, and I had to be her preceptor while she was in school. So I have that teaching background too. I'm not a teacher, but I have that teaching background too. That's why when I do my show, I'm also Abby Tyler's Healthy Living page on Facebook here for those of you who don't know me, and also it's on YouTube. So for your friends and family who are not on Facebook, just go on there, like and follow. I come on Tuesdays at 7 p.m. I do long-term lung show, like about 15 to 20 minutes, sometimes 30 minutes, depending on the show. And then I do Abby's Daily Dose, like a 90-second show, 90-second video during the week and all that too. So I'm happy to be here. Thanks for having me. This is my first time here. Like I said, Tom Lee and Henry been trying to get me on. So Talvina asked me if I can come on today. So I'm on, and thanks for having me.
So the guy's been trying to get you here forever, and you snub them, but when Tavina call you, you show up. You see how they treat us, Johnny. You see how the people treat us. No respect.
They understand, they're my friends. So they understand.
Well,
I told them because I told them that never got it arranged the way, So I said, when Tovina asked me, I said, fine, I'll come on.
Great. Well, ladies and gentlemen, we are trying to we're coordinating the schedule. We got some folks coming from Central Time. We got some people coming from Houston, from all over the place. So we are several hours apart. Some people want 2 hours. So it is 5:30 here, maybe 3:30 in other places, maybe 4:30 in other places. So we will go ahead and start a show, and then they will join as they come. So today's show is about breast cancer, especially for women.
Excuse me.
Yeah, go ahead. Okay. So, Abby, today is about women's health. We are here, Namwe and Johnny and I, we will be students for the day. We can't be paid. Even though men do have breast cancer, I want you to touch on that as well. But specifically today, we are here on the topic of women's health, specifically breast cancer. Let's begin the class. What is breast cancer? What are some of the reasons that we get breast cancer? What does it do? And then the prevention, medication. What are the new technology? What are the new treatment? Talk to us about breast cancer.
So this is mostly breast cancer awareness, okay?
Yes.
Let's start with the beginning here. What exactly is cancer, right?
Okay.
Cancer is a group of over 200 different diseases in which abnormal cells multiply uncontrollably, destroying body tissues or functions. Cancer can form in almost any place in the body, and each cancer is named for the tissue type or organ in which it begins. All right. So we're going to be talking about breast cancer. Again, before I start, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. All right. That means check with your own doctor first before you say, Abigail, such for me to do this. All right. By law, I have to say that. All righty. So for breast cancer, the guidelines and everything, the American Cancer Society, United States Preventative Task Force. All right. So basically 1 in 8 women will get breast cancer this year, will be diagnosed with breast cancer this year. All right. Those people have no background, like your mother, your sister, your grandmother have no background. Those are people we call average risk, meaning that every woman is at risk for breast cancer. As you get older, you can still get it when you're younger, but you get it, your risk for getting it gets higher as you get older. So, but those are people at average risk. The people who are higher risk are those people who have family member. Let's say again, your mother, your sister, or sometimes your grandmother, and that could be on both sides too. It's not just your mother's sister or your mother's or your sister. It could be your father's side as well, because your paternal aunt also could have it, or your grandmother. All right. So we're talking about those who are average risk, no personal history of breast cancer, no strong family history of breast cancer, no genetic mutation associated. The BRCA gene is BRCA. Anybody know that actress called Angelina Jolie? She made that popular. If you have that gene, because they do genetic testing, if you had that gene, you have a higher chance of getting it. If you had any kind of radiation to your chest, let's say you had maybe lung cancer or something else that was going on in this area, basic area, and they had to do some radiation in the past, you have a higher chance of coming with that. All right. Now, also, we're talking about women here. We're talking about people who were born female. All right. So it's not anybody who had like transition, women who were born female at birth. All right. I don't know if you're going to be asking questions, because I don't want to just keep talking.
Yeah, yes, we'd have time for questions. That's correct.
Okay, so we're talking about some of the race now, all right? The race. White women are slightly more likely to develop breast cancer than Black, Hispanic, and Asian women, but Black women are more likely to develop more aggressive and more advanced stage breast cancer and diagnosed at a young age. All right. So again, right, Black women, you get it, we get less of it, but when you get it, it's more virulent. All right. Sometimes it also could be from the environment to, let's say you live somewhere where they had different factories, different things where there's a lot of pollution in the air too. They still haven't narrowed down yet, but that's one of their risk factors too.
So that will bring me to my first question, Abby. I'm sure you want us to ask as we go along.
Yes.
We don't get to hear much. We don't hear much about breast cancer in Liberia, but we hear a lot about it over here. What does that mean? Is it that it's not being reported, or is it just not as prevalent?
I think it's not being reported, because you know how we find out things over here, and then people say, "Oh, we never saw these things when we were growing up, and this was not that much when we were growing up." It's just that it wasn't being reported, it wasn't being diagnosed, and all.
Okay.
And back home, most of the time, so everything is either witchcraft or God's will. So,
Right.
and there's some kind of the stigma that comes along with any kind of illness too. So people don't talk about it. And even if you have in Liberia, like the treatment, the screen, the treatment, and all of that. So I think it's just the awareness, and people are not talking about it as much. But I've been seeing a lot of shows, and it's becoming more, people are more talking about it. I saw different podcasts in Liberia during October, they were talking about it. So people are becoming more aware, especially with the advent of, technology and social media and all. So people are becoming more aware of it now.
Great. Let me go to Dr. Mary Simons real quick. When in your line of work, to where you are now, what are some of the obstacles about why Black women, or why maybe poor women? Let's say poor. Let's deal with the color. Let's deal with Black women, because poor people are. Why are we diagnosed late?
I think Dr. Tyler has done an amazing job in explaining all of it. But, we don't self-exam our breasts like we should. And like she said, sometimes women don't want to do that because of how they've been taught by their mothers, their grandmothers, and they don't want to touch themselves and do the self-breast check. And then if the diagnostic like the breast, mammograms, if they're not available in the area where the woman is, to go get their mammograms done. And then for women who have heavy breasts, it's getting a special type of mammogram done that they have to pay for, and sometimes they don't do it. And women as caregivers, we do things for ourselves last. We take care of everybody else and we put ourselves last. So that's some of the reasons why we get diagnosed late. And by the time we get diagnosed late, then we're in third and fourth stages and it is already metastasized somewhere and you're having a problem. My daughter in love died in 2021 from breast cancer. So I have been a champion in my area trying to get women to do their self breast exam, trying to get women to go get their mammograms so that they have information that they can use and be knowledgeable about their own body, like Dr. Tyler says.
Quick
So besides,
MC Tyler.
besides mammogram. Oh, I'm sorry. Abby, go ahead.
Okay, we have to go. Let's go risk factors now, so that way we
Yes.
go in order. Okay.
Okay.
So-
Real quick, before we get to that, you want to say something, Victor, real quick?
Yeah, I just wanted a little bit clarification. I do realize I'm not sure if we have mammogram, testing facility back in Liberia. Are there any options that are available to people who may not have access to them? And what is a mammogram actually? Is it an ultrasound or what is it?
The mammogram. I'm sorry, I couldn't even bring it. It's a mammogram. Just like it's a huge machine. It's a really huge machine where they take your
Okay.
breast basically, and you walk into the machine. They take your breast and they basically put it there, and it takes a picture of it to flatten out the breast and all. So
Okay.
you put it in there. It takes pictures under your arm and everything, and then they look to see if there's any kind of discoloration and all. Sometimes, if you can, they can do that. Some people send you usually the screening to is mammogram. They prefer to is mammogram, and then also you can follow up with an ultrasound. Some people tell
Okay.
you, like when I write the prescription for somebody to get a mammogram, depending on their medical history, I may say you do the mammogram and then follow up with an ultrasound because we want to have a better picture, a more definitive picture, and all that.
Right. Okay.
So some of the high risk, I talk about the average risk now. 1 in 8 women would be diagnosed this year. She did touch on the breast exam. We talked about the breast exam before, but most people don't know how to do the breast exam. And also, more studies came out that people do the breast exam and they may not do it right, and they get scared and they go to the doctor and we have to do biopsy. So, and then sometimes they might say don't do it. So a lot of people were getting unnecessary tests. So yes, you can do your breast exam, but like I tell everybody, make sure that you look in the mirror. You can look at your body naked. You know what your breasts look like and all that. When you're doing a mammogram, when you're doing your breast self-examination, I don't want to, demonstrate on that right now, but it's just, I'll get to that. All right. So higher risk would be your first degree relative. Again, like I said, your parent, the mother, maternal aunt, paternal aunt, and all that brother. Sometimes your daughter, if your daughter had breast cancer too, but usually somebody who was already born with you or before you, if you had any radiation to that area. And so what are some of the signs you want to look for, right? If you see any lump in your breast, all right, look at your breast you can look at it like maybe every once a week, but when you take your bath, you look at yourself anyways, all right? Any kind of lump in your breast, like a dimple, I have a dimple in your face, you see any kind of dimple and you didn't see it there before, all right? Any kind of discharge from your nipples, all right? If you're looking at your nipples there and you squeeze it, you're not supposed to get any kind of, if you're not breastfeeding, put it that way. If you're not breastfeeding, you're not supposed to get any kind of discharge. No blood, no milk should be coming from your nipples at any time. All right. Any kind of swelling lymph nodes, like when you look under your armpit, it shouldn't be swollen when you're touching there, because when you're doing your breast examination, you're looking at the entire breast. You're looking under your arm because you have breast tissue, mammary glands under your arm as well. So you're supposed to be looking at there. Any kind of redness or dark color, thickening of the nipple of the skin. If you're a Black woman, of course, if your skin would be a little darker, it won't be red. All right. So you're looking at, you're seeing different color, discoloration and all that. That's a sign. You're like, wait a second, I haven't seen that there before. Let me keep an eye on that. You're not going to go run right away to your doctor to go find out. You're going to, find out from there. Any kind of swelling of the breast. You know what your breasts look like now. Of course, if you still see your period once a month and all that, when you're getting closer to your period, your hormones and everything, your breasts are going to be swollen because your body thinks like, okay, yes, we're going to get pregnant this month. So when you're not, and you're going to get swollen. So you don't look at that as, okay, yes, maybe there's something going on. She told me if my breasts are swollen, but that's just when your hormone dies down because the body doesn't get pregnant. Then that's when they tell you, okay, you're going to do your breast examination. Then you can do that after your period, maybe like a week or so after your period, and your breast goes down to where it normally is. All right. in any kind of pain. You're not supposed to really have pain in your breast, but that doesn't mean there's so many different things, but doesn't mean that you're having, oh my God, I have cancer if my breast is like painful and all. Again, like I said, you could be hormonal changes and all that. So those are kind of some of the symptoms that we look at when we're looking at, we say maybe there's something going on there. Let's go ahead and get the mammogram. Of course, you're going to be getting, when it's time for you to start getting screening, your doctor, your GYN, OB-GYN will be talking to you about that, your family doctor and your OB-GYN. So hopefully by then, you should be going to go see your OB-GYN. Usually at age 21 is when we start telling people to go see the OB-GYN. And then breast cancer, any kind of breast cancer screening, we start around like maybe age 35 to 40, depending on if you had any family history. And we'll say, okay, your sister had breast cancer. When was she diagnosed? Your mother was breast cancer. When was she diagnosed? Then usually at that time, we start telling you start getting get screening before then.
Yeah, I was going to ask whether there is a recommended age to begin screening. I think you just touched on that.
The recommended ages is age 40 to 44. All right, women, you can start that option at a time. Again, you have your average risk. All right, again, like I said, you don't have any mother or sister, anybody who has that, but advanced or higher risk. All right, age 45 to 54, you should be getting your annual mammogram. They're recommended every year from age 45 to 54. Age 55 and older, again, you're going to be speaking to your doctor about that, depending on your other risk factors and your family history as well, okay? Women can switch to mammogram every other year or continue yearly mammogram, but your doctor will be telling you that. I say, some doctors like, no, I want you to continue doing every year until at least age 75. Usually we don't screen as often after age 75. All right, so that's the age group to tell you that average risk, but your higher risk, you want to start earlier, like we're at age 40 or so.
Okay, I have a question.
Thank you.
And
Johnny, just give me a second.
and,
Let me welcome. Johnny, can you hear me?
Okay.
Can you hear me? Yeah, just
Yes,
give me
go
a
ahead.
minute. Yeah, let me welcome Ms. Massaquoi
Yes.
and also Mr. Miller. Thank you for joining us. Welcome to the set.
Thank you.
Okay,
Thank
Johnny.
you, sir.
Yeah, go ahead, Johnny.
Okay, so Abby, I'm curious about when you said women, black women have, low risk, but if it comes to them, it gets very severe. So I'm looking at is it black women in the developed world because of the environment, they are risk fighter, or black women in general, wherever you are?
Usually when it's black, African American, we put everybody together there. So, but of course, when you're in a developed world, you're exposed more to other chemicals and other things and environment and all that, but mostly that. But then again, like I said, you don't do too many studies with people in other countries. So when the studies are coming, where at this point, black women get it at a lesser rate, not much because you're still 1 in 8. But when we do get it, because we get screened later and we get tested later, because again, like I had the teacher said, the professor said, so when you get to that point, you're not getting tested. Early detection is key. It's always early detection is key. So you're getting detected later, and when you get it, it's more virulent, and it's like the stage is much higher from zero to like 4. And most of the time when we get diagnosed, it's at a later stage, especially if you weren't getting your mammogram as prescribed or as recommended. So.
Okay. All right. And Mr. Goodman, welcome back. Yes, Miss Delvina Cole, welcome as well. So,
Howdy. Happy Friday.
Happy Friday. Jerome, why don't we go around before we hand it back to you to our 3 guests who are just joining us to say a word or 2 of introduction and whatever they want to say about this subject. We'll go with Ms. Massaquoi and then Mr. Miller and then Ms. Cole will be the last before we come around.
Great. Just before we go ahead, guys, that is your earpiece. You want to take your earpiece off? Do you have an earpiece? Mr. Miller, do you have an earpiece? He's not hearing us.
He's saying he cannot hear.
Oh, maybe you should go out and come back.
Come back out. I mean, go out and come back in.
Go out and come back in.
Good. We're going to do this in 2 parts. I'm going to do the first part, which I have done. Then it will be Telvi and Mr. Namwe for the second part. So we're going to go back around to do the introduction. It looked like Mr. Miller is still having problem.
Yeah.
Let me start with Telvi on this one. Telvi, can you hear me?
Yes. Happy
Okay.
Friday. So
We're doing
first,
introduction.
introduction.
That's correct.
Okay, happy Friday. I want to thank everybody for joining us. I want to thank our nurses for all they do, and for Abby and Faletta and Mary. I know Dr. Sumo is joining and our survivor is joining later, but just taking time on the basic schedule. We know how hard they work, but just to take some time to create this awareness, we don't take that for granted. So thank you, and looking forward to learning from all of you today.
Quick point of correction, Telvi. Like they told us in school, when you work hard for your degree, make sure they call you by your title. We're all
Yes, please.
But,
My party, Abby, Oh, salute. Yes, salute.
You know?
All of y'all. And look at all these MPs here. Look at Faletta, my childhood friend Faletta. All these MPs. Y'all forgive me, or y'all don't tell me can talk plenty and fast too. MPs, all these MPs, brilliant women, and yes. Thank you for correcting me, Abby. Thank you. It was not intentional.
Thank God it was an error from a woman and not from a man.
I know. And Abby will not spare nobody.
So, Telvi, it's your turn to moderate this show.
No. Keep going.
Yep.
Keep going.
At the end, Victor will take us home. I have a speaking engagement in another hour, so it worked out.
Valetta needs to introduce herself too.
Yeah, everybody.
Yeah, that's what we're saying. We go around after Telvi is done. Telvi, tell us a little bit about you. Say everybody sees you here, but they don't know who you are.
Hey, man. Who don't know noisemaker Telvi? Okay, on a serious note, Telvi, I live in Texas. Love advocating women issues. By profession, I am a cybersecurity analyst. My background is in governance, risk, and compliance. So right now I work as an information technology risk and security consultant. And so really the focus is really security, AI, and just technology. But other than that, I like to play. I like nature, and I love reading. Just engaging people, having healthy conversations. Of course, I like learning, but I have two young daughters. I don't even know what their age is anymore, but I think on a serious note, I think they're 25 and 27, but all good girls, and glad to be on.
Excellent. Valetta Johnson Massaquoi.
Yes, hi, I'm Valetta Johnson Massaquoi, and I heard you say Miss Massaquoi. I'm mistress. My husband would put you to court if you heard me say
Oh,
Miss.
Lord.
Yes.
And
I don't want to run into any Massaquoi.
No,
So
these nurses not playing with us today. They're not going to let us fly.
and I put Johnson in the middle of my name, so that way when I introduce myself, the Massaquoi people know I'm married into it, and they don't ask me who my dad is, because there are a whole lot of them. So that's why my name is so long. But anyway, I'm Valetta Johnson Massaquoi. I heard you in the earlier part of the program asking Abby which high school she went to, and you were like, "Oh, it's a convent girl thing." I think it's just a Liberian woman thing, because I didn't go to convent. I went to SDA Adventist school all my life.
SDA, there you go.
So everybody
Convent was
will
still
post
the best, though. Convent still the best.
Everybody will post about that school. Trust me, I can post a whole lot about SDA. Convent got nothing on me, girl.
Oh, SDA in the house.
But anyway, I have been a nurse for 20 years, and I'm a nurse practitioner now. I work primarily as a nurse. I work in cardiac flow, med-surg, tele, and I also did some preceptor work. I'm also a member of the board of the school I graduated from. I graduated from St. Kate's for my undergraduate, so I serve as a board member at that institution. And currently I work as a nurse practitioner. I have been doing pain management. I did not do primary care, even though I love it, but I felt like it was going to be too much. So I did pain management, and currently I work as a nurse practitioner seeing patients in transitional care and nursing homes for pain management. So that's where I'm at. I'm married, like I said, and I have 3 beautiful children, and I live in the beautiful state of Minnesota.
Thank you, Minnesota SDA. I tell you, Convent SDA has nothing on Bassa High School. I am from the great city of Buchanan. So now you're talking about it. You know, we got more pride from our high school than college. College got nothing on our high schools, and I love it.
So I
but
can
tell
add
me,
to, hold on, before I go further, I can add to that. But you also said Bassa High School. So, okay, we'll see. But previously, before coming to the US, I did go to the university and I have a previous degree from there in biology and chemistry. And I spent 1 semester in medical school before moving over to the US. So,
our high school carries the most weight. We love our high school.
Never even heard of it.
I went to the University of New Jersey, Rutgers, but it got nothing on Bassa High School. That's my foundation, and I love it. Let me go to Honorable Tokpa.
Yes, sir.
Introduce yourself. We high school first, so we can clap for your high school.
I'm Tokpa Miller. Went to St. Kizito High School in Pinsville.
yay.
That's where I graduated.
That's my parish.
I also attended the University of Liberia. Sophomore before I moved over to the US in 2003.
Excellent. And now you are?
Right now I am a nurse practitioner. Been a nurse for 19 years, 5 years nurse practitioner. Got my bachelor's at UTA, University of Texas, Arlington, and my master's at Chamberlain University in Chicago. So, yeah.
Wow. Ladies and gentlemen, listen, if y'all sitting down in Monrovia or somewhere in Bapulu or Benjamin, they just sitting in America, just running their mouth, they ain't doing nothing. You are a liar. You see the amount of school these people that go to, and you combine it at over 100 years. 100 years of schooling. Mary Summers, I know you're not from Liberia, but you did go to a high school that you are proud of. Where did you go to high school?
I want to say that I do feel like the odd woman out here today, but I do have. Remember, I have a Liberian name,
That's
Deity. And when I went to Vito Town, I got the Liberian name of Deity. My high school here in Florida, so I'm in Fort Pierce, Florida, where Jerome is, and the high school is Oakland High School in Haines City, Florida, and we are the Rattlers. Let me tell you, when the Rattlers bite you.
Johnny, what high school did you go to?
Rattlers.
My high school was the best high school ever in Liberia, West Africa. And this is the high school that I was in Port Mines. It was a German supported high school. So I think everyone in Liberia knows what Bontown School is. We never fail. We never miss anything. We are the best in Liberia.
Okay.
Oh, my! Is Beaumont in the high school still there?
No, it's broken, destroyed.
Hey, man. Why you did that to Johnny, man? Johnny, your school died. I'm sorry, Johnny. But let's get back to business. Otavi and Victor, we are glad to have such a great panel. I mean, we are talking about education. We're going to open the line. We're going to do all of these things. And tell me, you go from there. These are our guests. We are ready to talk business. We are ready to talk health. And
what there? Y'all keep it on. Abby was already flowing. Abby was talking about something. Y'all stop. I'm just supporting. You know.
That's correct. Abby, you guys are the health folks. Those are us here. We are the talking head. We don't know nothing.
Right.
Okay, I just talked about the screening age and all that. So if somebody else wants to start talking about, Velada, did you want to add anything or?
So earlier, I know you talked about some of the risk factors about breast cancer, but let's go back to some of it that we keep, the ones that you cannot get away from Because I know there are some that you can say, okay, based on where you live and stuff like that. But there are some that makes it hard. The first one is being born a female, although men can get breast cancer too. But if you're a female, then your chances, you have a huge risk factor. And as we get older too, so aging. So we can't stop the clock and say we can't get old. And then there are some genes that you inherit from your family. So one of those genes mostly is like about 5 or 10% of breast cancer come from hereditary behavior. So like if you have the BRCA gene, it's BRCA1 and BRCA2. Those are the genes that are most common in giving in like having people at risk for breast cancer. So like if you have a mutated gene from that and from your parent, because sometimes over a year I've seen that sometimes some people have like family member, like a mom or a sibling who died from breast cancer, and we do not be aggressive enough to go and check and do stuff for it because most time you will have that gene. So those are some of the risk factors that I just wanted to put out there.
Let me ask you, Mrs. Masako, again, thanks for coming. You talked about, being predisposed because of your genetic makeup. Now, I know we're in the age of genetic engineering. Are there any thoughts along those lines, or is it too early?
It's
So,
still
for
too.
instance, for
Uh-huh.
instance, if it is found that you have this gene and therefore you are at a higher risk, is there a chance for you to go and have some kind of change made? Let me keep it as simple as that.
So some people who know that they are at risk for this gene, when they get tested, they don't do a change, but what they do is they get very drastic. They go
Okay.
and they do a total double mastectomy and take out lymph nodes and stuff to help their chances. If you know, a couple of years ago, Angelina Jolie,
Right.
star. So her mom had it and she had the BRCA gene, and that's what she did. And so for
Okay.
now, she's doing well. So sometimes you have to be drastic. Because my dad always used to say, drastic sickness need drastic cure. So
Right.
sometimes you have to be drastic in order to be able to buy time for yourself. It doesn't always make it 100%, but at least you're buying time.
Okay. Thank you very
Also
much.
with the BRCA gene too, you can do the double mastectomy, meaning you're taking out your breast and all that. But because it
Right.
has a higher link to gynecological cancers, to meaning any kind of cancer below your belly button area, your pelvic area. So some people end up taking out their womb, which is your uterus, and also take out the ovaries and all that too. Yeah. So take all your baby making
Talking
things
about
out there.
taking drastic
So,
measures, right? Got you.
Yeah.
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 So you can do all
Okay.
that. Your doctor would warn you. And some people, especially if you're very young, you haven't had any children yet, you can freeze your eggs. But there's so many different options your doctor can go along with. You can discuss that with your genetic counselor and also your doctor too. And then people high risk OBGYNs, and they can give you different options to follow through with that.
So
And some women start looking at their nutrition. Because of it being estrogen driven, they start looking at reading everything to make sure that there's no estrogen there because of it being estrogen driven. So men don't have to worry about that because they don't have any estrogen. But
yes, and that's what makes it also more, difficult or deadly when you're still seeing your period and you get cancer and all that, because you still have the estrogen flow in your body. And also if you haven't reached menopause yet and you become pregnant or you get cancer and all that, it makes it more difficult to treat.
So we also want to get our only male to show his thoughts on the same question, but let's welcome our survivor, Quita Kese. She's joined the panel too. She's a breast cancer survivor and a social worker. But Quita, we're just doing, you didn't miss much. They were just talking about some preventive care and some risk and all of that. So like we did with the other people, we're just going to introduce yourself, and then we'll get to Mr. Miller to chime in on the one question, if you don't mind.
I don't mind. Good evening, everyone. I'm Quita Kakula Kesa. I was invited on by TC, and so I'm excited to be here. Like she said, I'm a clinical social worker specializing in child protection, and I'm a survivor. I had breast cancer about 12 years ago. So yeah, happy to be here.
Thank you. So, Mr. Miller, if you want to chime in on that one question before we move on to other things.
I've been in and out. What was the question?
So I think we're talking about the risk and some of the ways that you can get the cancer and prevent it.
Oh yeah, of course. I mean, I'm glad to be here to give my input as a male. For our, you know, that being breast cancer, being a female is already a risk factor, like she just alluded to, due to all the chemistry and everything else. So just being a female is a risk factor. Okay. And then you talk about those who are overweight. It has to do with genetics also, family history, alcohol consumption, that's also a risk factor. So a lot of things can play into the way you take care of yourself. And also, if you're not very lucky and find yourself in a family that has, all these genes and these markers, you have to be careful. So that's why we always talk about early detection and encouraging everybody to have the mammograms and to do self-breast examination, clinical examination, and all that. So the key here is the early detection, because we know from the survivor, there's a lot of survivors of breast cancer, but you have to catch it at the right time to survive, So.
Thank you, Tevi. Can I quickly? So I know the men are considered outliers here, but what do we look for? How do we check ourselves? I know we spent a lot of time tonight talking about how it works with the female body, but for the men, what are some?
So
For-
men do have risk factors too, like women. Being overweight is a risk factor. Having certain gene too, or if it runs in the family. But a lot of men who get breast cancer, the higher the age, the higher the risk. Okay, so that you did talk about the symptoms. So a lot of times symptoms are similar to women, but it has to do with you as a man. If you feel lump in your breast, you have to be careful about that. You have to have it checked out. Also, discharge. Some men do have enlarged chest or breast. Men do have breasts. So
Right.
if you have that, you have to be careful too. But there's other genetics that play into it, other syndromes that put men more at risk, especially those who have extra X chromosome. I don't want to get into the chemistry of it, but how men have the XY chromosome. Some men have extra X chromosome that can also increase your risk factor. So yeah.
And to
Thank
add
you.
to that, the famous person that I did my show also on men at risk of breast cancer, Beyonce. Beyonce, everybody knows her. Her father, he was working, and he said he used to wake up in the morning and he saw some blood on his pillowcase and on the sheets, and he was wondering. He said, after a while, he started looking. He's like, "Wait a second, what's going on? What's going on? Why am I?" And he started seeing it on his shirt and all, and that's when he went to the doctors, and then they did the testing. Yes, men can get mammograms too. It's a different way because you don't have the heavy breast tissue like a female, but that's how they found out that he did have breast cancer too. So he had history of breast cancer, and I think that her mother she was just detected early and was like stage 1, and she got and they were able to like not get rid of it, but like get the treatment and all that. So both of them now. So if you have mother and father, your risk is even higher of getting it now. So again, like I said, Beyonce's father, you can go and read about his diagnosis and how he was treated and all that. He was very open about it because he wanted a lot of men out there thinking that they can get breast cancer, even though the risk is lower. But yes, there is a chance because you have breast tissue also. So yes, there's a chance you can still get it.
That's for the men. Any one of the nurses want to add? Faletta or Mary, do you want to chime in on that before?
I hope that there is a spot to talk about the spiritual, psychological, and the emotional aspect of it. And from a ministry perspective, you talk about your titles as an evangelist and as an assistant pastor. where I am, I want to talk about that spiritual aspect that women go through with the breast cancer.
Sure, we'll get into that. Falada, you got anything to chime in on the men piece before we move on?
No,
I have a question for the men. Should they be? And I know some of these answers, but I'm just asking just for awareness, to educate the public. Should they check like we go every year on our annual? We check everything. What should they do the same?
Right now, that's not a recommendation unless let's say if you have a family member, if you have breast cancer that runs in your family a lot, family history, they will tell you, say your mother had it, your sister had it as a man too, you also want to get checked, especially if your family member has that BRCA gene, the BRCA gene that we talked about. Yes, you can go ahead and you talk to your doctor. That's why it's good to be seeing your family doctor once a year and also talk about your medical history and all that, so they can see, okay, this is what's going on. We have your family history, you have breast cancer that runs in your family or whatever cancer that runs in your family, and then they put you at a higher risk. Again, like I said, there are people who are at average risk and there are people who are higher risk, and that way your doctor can say, okay, I recommend maybe you go for your mammogram, or let's do an ultrasound, because you can do the ultrasound where they just put the gel on your breast and they can go there, and then that can also follow with there. Sometimes if they see something more than that, they may say, let's follow up with an MRI also. That one's like much more definitive, but it's also very much expensive if they absolutely have to do it, and I think they can go that route.
Okay. So get some
This is Mayor. I'd like to also say during this time, we're talking about breast and with the men, but I think that we need to talk to the men about their testicles and testicular. So just as we do in the shower, our assessment in the shower, they should also do the assessment of looking for testicular changes that can occur. Because men that really don't want to go to the doctor, they don't want to do these things. But that is just as we look at breasts, they need to look at the testicular problems.
Yeah, we can have another show on that for the men.
Yeah.
But I know we will. But
Yeah.
is I guess you got a hysterectomy. Is that an option for men as well?
Men don't have men can get hysterectomy because you don't have a womb.
What was it you were talking about? They're taking out removal of the breast. I'm sorry.
I'm talking about if you have that BRCA gene, if you want to go all the way, because the BRCA gene puts you at a higher risk of getting cancers below the belly button, your pelvic area. So basically they'll tell you, okay, let's take out the womb, let's take out the ovaries and all of that. Take everything else out there, just leave the vagina and the rest of it there. So that way you don't have a higher chance of developing ovarian cancer or uterine cancer and all of that. So, but your doctor would discuss your risk factors with you.
Okay.
Okay. So before we get into it, I want to hear from the survivor, her story and how she diagnosed. How she found out she had this. But I want to talk about prostate cancer a little bit because that's something that's common and people overlook it. So can you share?
We can have our own day. We can have our own day.
Like, all together now.
No, it's not.
It's not together. You're too busy.
Yes, that's true. That's true.
A different show. You want to do a different show for that?
Yes.
And okay, we'll put it one side.
LV, when you're ready, I will come on. I'm a survivor. I just
really?
2 years on now. Yeah, I had enlarged prostate. I did the surgery.
Well, what the nurse is willing to do is we'll do a part B on that.
So yeah, when you're ready, I can join you and talk.
Okay. Got it.
And that's why I need to watch Abby Tyler's How to Live in Page. I did a show on that already. Very
yes, you put a lot of work into that. Yeah, so what do you have for Quita as we're talking about? Because she's a survivor. So if you don't mind sharing, and I keep saying that because I don't want you to feel obligated to share what you don't want to share. So just whatever you feel comfortable with. If you want to tell us how you found out you had cancer, your journey, the support, your treatment, what it was like, just to encourage somebody.
Yeah. First and foremost, I want to appreciate you guys allowing me to come on and tell my story or share kind of my experience of breast cancer, it was quite the journey. I was diagnosed when I was 29. I had no family history of breast cancer as far as like my family. No, my parents are both from Liberia, so I don't know if they know the extent of their medical history as far as generations are concerned, but from what they shared, they didn't have any history of breast cancer. And so I was about 29 years old and I had felt like this lump on the right side of my breast, and it was pretty hard to touch. And so it was bugging me. And my sister, who is a nurse, she had encouraged me to go ahead and go see my primary doctor. And so I was like, okay, the appointment, went in to go see my primary doctor. And one thing I will say as a Black woman, when you're receiving care with healthcare, you have to be a really strong advocate for yourself and really understand your body. And if it doesn't feel good to you, really push back with your care providers to get that second opinion, or to get that further testing. Because initially when I saw my doctor, my primary doctor, she had communicated to me like most women your age get fibroids in their breasts, and really was trying to like downplay what I was feeling and tell me that it was fibroids. And I told her, I said, I appreciate you saying that, but I just want to get like a further testing just to make sure, or whatever. I didn't have any like clue or any insight to say like whether it was breast cancer or not. But I know that it didn't feel comfortable to me, and so that's where the advocacy came in for me. And so she was like, sure, she made an appointment for me to go to Regions, to kind of get that further testing that I was requesting. And so when I went to Regions, they had communicated that my breast was pretty dense. And so they needed to do an ultrasound of my breast to really kind of get, to figure out what the lump, if it was really fibroids or if it was more than fibroids. And so they had did the ultrasound and then wanted to do a biopsy of the spot and draw some of the liquid that was in there. And they went ahead, did the biopsy. And I'll never forget, like the doctor had told me, he said, it's probably nothing, but if we end up calling you, that means that it's something and we want to further test. He never used the word cancer or anything like that, but they were like, if there's more than, what comes out, we'll call you. And so, being naive, I had like that first no, like, I had that first instant of like what my doctor was like, this is just fibroids. So I'm thinking, oh, it's just probably just fibroids, what she said. And, just kind of going on my merry way. And then that Friday, I got the phone call and the doctor had called, and I saw the hospital call, and immediately like my heart just sank. And I was like, I wonder why they're calling. And so picked up the phone, and the doctor was like, I'm so sorry to tell you this, but the biopsy, the tissue that we took out of your breast, it came back positive for cancer. And they didn't know like all of the staging and everything like that. I needed further testing for them to determine that. And automatically you go to like worst case scenario, right? When you hear the word cancer, you don't think, you start, all these different thoughts start to go through your mind. You're thinking like, is this going to be the end? At the time I had two small children, and I'm like, am I going to be able to see my kids you just start thinking the worst. And I had to really, I had to really just reflect on my Christianity. I had to really like step back, because it feels, when someone tells you you have cancer, it feels like an out of body experience. It's like once you hear that word, everything else sounds like wah, 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 wah. You're not hearing anything else after you hear the word cancer. You're just hearing wah, 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 wah. So everything else if he told me what stage it was, if he told me, I didn't hear anything. All I heard was cancer, and that was it. And so, I thought about, like I said, I thought about my kids, I thought about my husband, I thought about, what would come next, what would treatment. All of those things start to run through my mind. Am I going to survive it? Am I not going to survive it? What am I going to look like? How is this going to impact me? How is it not going to impact me? Just thinking along those lines. And I just found myself just needing to just cut the world off and just focus on prayer, and just focus on, like God at the moment, like, God, if you allowed me for some reason to find this illness, this test is not going to be greater than this testimony that you're going to give me. And that was kind of my like my self-talk, like my mental health to keep myself afloat going through this, is that this test is not greater than the testimony that's going to come out of it. And so the journey started from there. I went ahead and met my oncologist, who was a really young man, and he was like, "You're so young." And he, at that time, now I could hear what he was saying to me, like, "You have triple negative breast cancer." So meaning, like, my breast cancer didn't really respond to estrogen or anything like that. Like, the only thing that really could help the type of breast cancer that I had, was chemotherapy and radiation. Like, if that didn't do it, then at the time there wasn't anything that, other than that regimen, that they could treat it with, because that breast cancer, the triple negative, from the research that I did, and then like the communication that was from my oncologist, was really impacts African Americans and Latino women. And oftentimes that specific cancer, they don't read it. There's not a whole lot of research into triple negative, right? So the mortality rate for that was super high. And can you imagine, like, hearing all of these things, like doctors and telling you, like, your mortality rate for this is really high, the recidivism rate for this is like after 3 years, and and you're trying to keep yourself afloat and trying to, like, encourage yourself through all of these. And I get it. They have to tell you what your chances are. They have to tell you what you're up against. I get it. But, like, from a person that's receiving the information, it's hard to sit in. It's a lot of information. It's so much information. I encourage anyone that's ever been diagnosed to have someone else with you to help you kind of hear everything, because it's just so much and it's so overwhelming that it's almost like you have to take little pieces at a time and figure out, like, okay, so I have this piece, I'm going to take this puzzle and put it here and put it there, as you're going through the process. And giving, when I did my research, and I also encourage people, like, when the doctors give you, a diagnosis or whatever, go and research that. Don't just, like, say, okay, this is just what it is, and I'm just going to go about my merry way, and you're going to do whatever you need to do. Go and find out what it is that they just diagnosed you on. If you need to get a second of opinion, get that second opinion. Look at what the rates are. Look at, what the survival rates are. I spent a lot of time, like, researching that triple negative. I spent a lot of time understanding that form of cancer. I'm not a nurse, right? I'm a trained social worker. And so really just trying to get out of my comfort zone and learn about what was impacting my body, and the route, and talking about it with my husband and praying about it, and coming up with what was the best decision for me, and the best decision for me after researching everything was to have a double mastectomy, because, again, this is a cancer that wasn't really widely researched, right? And so the mortality rate was very high, especially for Black and African American women and Latino women. And so the recidivism rate was like after 3 years. So I'm like, you know what? Maybe the best outcome that I have after praying about it is to have the double mastectomy, in the event that it wants to come back in the other breast, or whatever the case may be. And so prayed about it with my pastor, and ended up, and my husband and I went ahead and did the double mastectomy, where it was the removal of all of my tissue, the breast tissue, and all of that. And so I think that was the best decision for me. I went under chemo, very aggressive chemo. I'll never forget, walking into the chemo room, as someone that's, because I didn't feel sick, but walking into the room was the realization that I was sick. It was the realization of, like, there's other people that are going through the same thing that I'm going through. And it was stifling. It was like, it took my breath back a little bit. Like, wow, sometimes you don't, you're going through life and you're not understanding that there's a whole nother world happening here. There's all of these things. And so that first day going into chemo, I literally broke down, and I was like, wow, this is my reality. This is my right now. And again, just continuing to remain like encouraged during that. And my family, oh my God, my family, my husband was one of my biggest. I think had I not had my family, had I not had my husband, had I not had, my church, I don't know how I would have gotten through it, because it's so hard. It's a hard thing. You go from, I went from being a 29-year-old young mom who is busy working, taking care of her kids, to losing my breasts, losing my hair, going through all of these life changes at the same time, and like being emotionally stripped of everything. And so had I not had my husband, I don't know if I would have probably survived breast cancer, because as like debilitating as I felt, like debilitating in the sense like you don't know what it is not to have a breast until you don't have it anymore, right? And so feeling very debilitating, feeling like the most ugliest person in this world, all my hair is gone, and just my nails are popped off because chemo popped off all my nails. My toenails was gone, and just feeling very lethargic all the time, going through those emotions. And had I not had my husband just telling me how beautiful I am, and encouraging me through it, and just on the days that there was days I couldn't get out of bed, I couldn't even taste food in my mouth, like I couldn't, like there was no, like chemo stripped all of my taste buds away. And so in order for me to keep my body weight, I like had to force myself to eat. Like I would put the kitale in my mouth to like give me some type of taste in there, because there wasn't any. You don't taste food when you're going through chemo. It just, everything is just bland, and just tastes really gross, and then you got the nausea that comes along with it. And so it was a really I don't, go ahead, somebody. I thought, I don't want to, huh? I thought somebody was saying something.
No,
I don't
I
want
was gonna I was gonna ask.
Anything you can bump in with questions,
Yes, and let me thank you so much for sharing. I can already tell, you're already still getting emotional about this, and it's really, 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 formidable experience that you had. I was just wondering what kind of pre-surgery, what kind of preparation. Because it seems as though, I mean, yeah, they may never prepare you enough, but it seems as though, you just went smack in the middle of this, without full expectation of what you were, you're talking about the feelings you were getting, loss of taste, fingernails going and all that. And I'm wondering if you had any pre-surgery counseling or anything like that.
Well, thinking back, I don't think the only thing that my oncologist talked about was, that post surgery they would start chemo right away, and kind of like what the process of chemo would look like. But pre surgery, there wasn't a whole lot of communication about, like I said, like what like they went through my options, but not like there wasn't a whole preparation about like this is what it's going to look like and all of that. There wasn't a whole lot of that. There was just like, here's your choices. You can look at, either a double mastectomy, a lumpectomy, where you kind of just take the lump out, or take the one breast off that has the cancer. And that was like the extent of kind of explaining what the process would look like.
Thank you very much. Abby, this is your show, but we
I,
have another 30 minutes left. I know
I
you want to say
think
something.
I
Let me just,
think
Mr. Miller, let me
they're
just quickly.
coming. Okay.
Yeah, you were coming.
I think one of the things that helped her was her doing her own research. That plays a bigger role in any decision making, because you are filled with information and you ask the questions. If you await the doctor to give you the final verdict, like the option, like we're gonna do this. If you don't do your own research, you kind of go straight with the doctor. But what she did, I mean, that's mind blowing. the fact that she went ahead and researched and got all the information, she was prepared going in there. And having talked to her family, the support played a very big role. There are breast cancer support groups, counseling, services out there, but her family was with her. So that's why you see, even getting through the recovery, it kind of went faster than what normally, because that can take you way back 10, 20 years.
Good family support system. I'm sorry, I must have said Abby, but I meant Telvi. Telvi, we have about 30 more minutes left. I want us to spend a little bit of time, and this is your show, you're leading it, but if we...
What show?
Let's...
I want to say something. Can I say something now?
Yeah, Johnny, but I want to talk a little bit on the after, the day after, recovery and all of that. I hope we don't forget to talk a little bit about that, because Miss experience. So I think we should spend a little bit of time, but let Johnny go.
Johnny,
I'm sitting here, quiet and feeling, should I say sad, because all of these women are living in advanced society, like in the US, where they have the potential opportunity to be diagnosed.
Yes.
And I've worked over the last 15 or more years in most remote, difficult communities in Liberia. Almost 1 million women in rural Liberia. I'm imagining if they ever have such experience, how would they even be diagnosed earlier, and how would they even get treated and be cured from this? So I'm sitting here, listening to all these things you guys are saying, and wondering, how can we as a generation of people respond to the women's situation in Liberia, especially those in the rural parts, those difficult places, remote places? And I think cancer is like, it should be a serious health issue for us in third world country and for us in Liberia. And to the extent that, it just tells me that we need to do more in our health sector. Because I don't know how many women in Liberia, villages are carrying cancer along with them, and no one is telling them what is happening to them and how they can respond to it. And even right here in Monrovia, again, we have people living in very poor communities. They can hardly afford to go to the hospital. They're always living to go in the nearby medicine store or drugstore. When they feel some pain, they go and just buy any kind of drug and take it in. And this is a serious matter. I want to appreciate all of you, my sisters on the show, for coming up. I'm hoping that we can have a better organized forum where you will have enough time and talk about it more and see how your message can reach across good number of women, so you can take preventive actions if it's possible, because they may not have the opportunity to be healed or cured from cancer within the context of Liberian medical situation. But if it is possible, if you're diagnosed earlier, or is there a way to prevent breast cancer or any other kind of cancer that affect our sisters and mothers? So that's the question I want to ask. Is it possible to do any preventive act if you're diagnosed earlier, or even before being diagnosed? What can you do to prevent yourself, to save yourself from coming down with cancer?
That to add to that, and then the other people can add to it. So most of it is basically knowing your risk factors. Because again, nutrition, being healthy, eating healthy, keeping a healthy weight. I know we talked about obesity, and people hear obesity and they're like, oh yeah, only fat people can get cancer and all that. No. Okay. So eating healthy, watching your weight, go into your primary care doctor every year, getting your routine labs done, because that's when we start looking at the numbers, and something can come up and be like, okay, these numbers are your anemia numbers are a little bit off. Let's see, we do more testing. So if you're not doing seeing your primary care doctor every month, every year, or as often as you're supposed to be, depending on your other pre-existing conditions and all, then you run into problems later on. You can get diagnosed much later. Also, again, like I said, you can get it at an early age. Most times it's like later, but you can get it at early age. There's a Liberian woman that she was my classmate back home. Her name is Mayma Kamo. She has an organization called Tiger Lily Foundation. So she also donated a whole mammogram machine. This thing is big as a horse. All right. She donated, I think, to JFK way back in the day. And then it just went missing. Like, how do you misplace a mammogram machine? It just went missing.
Wow.
So there are a lot of other people out there who are also helping, who are doing things back home, and other organizations out there. You just need to look into it and see, and also petition your government also, because we talk about healthcare and government closely intertwined. But most of the times when we, as Liberians, we'll be like, oh, you go back home, you know, there's no stress there, and you're enjoying and everything is okay. But we don't, but then you talk about, okay, when somebody gets sick, next thing you know, they get back in the plane and come back to America, or go to another developing nation, or go to a developed nation, and that leaves the other people there at a disadvantage, because nobody, you know, advocating for you know, more improved structure in place, as opposed to just people coming there to volunteer. Like I said, people coming to volunteer, that's nice, but that's a supplement to, it's supposed to have a system in place. So everybody coming to volunteer could be just a supplement to what's already in place. So we need to take healthcare, preventative care, very seriously when we talk about these things. But most of us also, like, again, we go back home and we just sit there and be like, oh, like, we're sweet, and no, we don't worry about the hospitals, we don't worry about anything else until something happens, you know? So talk to your government, try, you know, electing people who really take healthcare seriously and all that.
Yes. Yes. I echo Abby. I echo what Abby said, really, about the government. You know, they have got to see this as a problem and put money where their mouth is.
Thank you.
Exactly.
Johnny, this is a whole lot.
Just a minute. Falata, if you've done an intro, can come in.
Yeah, there's this whole thing about healthcare. Trust me, every day some of us sit here and we know that we are blessed to be on this part of the world, to have all of these things, and we worry about the people. We worry about the people back home, but we can do things that individual, like Abby just said, somebody went there and gave you a whole machine and the machine got missing. So what is it that you want us to do for the people? The government needs to do something. When it comes to healthcare, that should be the number one priority of every government. But we don't want to be politics because we have nurses, but it kind of pains you when you see people dying for little things that they prevented. That when we grew in Liberia, JFK was the best. It didn't have the 100% preventive health care, but JFK had everything that you could go to and get better. That's why I brought some of us into healthcare. I was 10 years old and my dad was sick in Liberia, and he was sick for a long time. I used to watch my dad cry himself to sleep every night until he finally had a surgery with Dr. Jerome Nangana that killed my dad. And that was when I said, when I get older, I will be a doctor or a surgeon to take care of somebody. So it was in Liberia that my dad got better and he was able to live a life until he was in his 80s. So it can happen. But everybody just go there and they just do things for themselves. It pains me every day.
So do you guys have any information on the statistics of cancer in Liberia?
Just a minute. Johnny, before your question, let's go back. He was coming to chime in on here.
Just to answer your question, I don't have the numbers. And even if you get any number right now, it will be really wrong because they are not screening people. The truth is that people are not going to the doctor to get screened. How many mammograms are they doing in Liberia? There's not much. So you cannot really give a number. There's no way you can give a number if you're not screening. So the information is not there. But just to come back about the politics of it, there's always politics in nursing, regardless of what it is. You know, we have to push our government to do a little more. But it don't have to be entirely on the government. The government needs to open up. You have a lot of nurses, doctors, nurse practitioners around the world from Liberia. You know, I tell people sometimes that the war was a blessing in disguise. For some reason, there was not a lot of Liberia in the diaspora, but we are now because of the war, most of us. Okay, so let's utilize those who are in the diaspora who have. I belong to an organization, the Liberian Nurses Association. We do a lot of donations. We do a lot of projects in Liberia. Currently, we're actually doing a project right now for Phoebe Hospital. And the reason why I'm talking about this, I grew up in Phoebe. I was born in that hospital. So if you see how Phoebe is now, and you talk about the deplorable condition our people are living in, it hurts. So those who grew up in Monrovia saw JFK. It was a place to be. Phoebe was the place to be in the whole of Banga, the Bon County area. So, but you look here and you be like, okay, now I'm in a position to help. This is all I always wanted to be. I wanted to be a doctor. You know, Liberians, I want to be a doctor. I want to be a nurse. I want to be in the healthcare system. We grew up knowing these things. So to come back just to your question there, the healthcare system is down. We need to educate our people. regardless of the government, if the government allow us to come in and utilize the skills and the ability and what we can do, it's going to help, because you cannot prevent it, but you can lower the risks. Okay.
But you still need a structure in place. We can
That's
really be
true.
supplementing
I
that
agree.
structure
I
in
agree.
place.
I agree. And that's what I'm talking about, because, for example, right, we take in Continental Liberia. We have a lot of supplies here we can use. We've been advocating with the health department to give a, what about duty-free for medical equipment? We can bring a lot of medical equipment to Liberia, but we cannot be paying $15,000 for a consignment, a 40-foot container to bring things into Liberia. When, I mean, come on. The government has to step in. I see where they can do it, because we can negotiate here and get this equipment. We can get supplies. We can get teaching equipment. We want to go to Liberia. We want to teach our people. Matter of fact, we're doing a lot of education on the CPR, because we know where our nurses stand in Liberia. You know, my sister is a nurse in Liberia. So I interact with her. I ask her, I know her level of nursing, you know, compared to a nurse here. But we're not looking down on them. What we want to do is to bring them up, and it's through education. So the risk factor is what we can lower. For example, our women in Liberia do drink a lot of alcohol. I'm sorry to say, but it's true. That's a risk factor.
Yep.
Okay? For the young people, when you are taking these pills to prevent pregnancy, you have to know what you're taking. You can just take any drug that comes to you and you say it's a preventative medicine. Those things have higher risks for breast cancer, a lot of them. So you have to do your low research, and you have to try to see a doctor. I know it's hard for us. The money is not there. But in Liberia, the truth is that a lot of doctors will allow you to come even the first time and just talk to you.
Okay. So it's a good conversation, though. I wish we could do this longer, but we'll do a part 2, a part 3, a part 100. But we don't want to be selfish. I have we want to open the lines for our viewers to call in with questions or kudos or whatever it is. But as they're calling or before the call, we'll still continue the conversation. And if you know any of us numbers, you can call any of the panelists or call my phone directly, and we'll put the phone on speaker, and we'll put it. Or you can call the numbers that are on the screen as well. So as we're waiting for calls, I have one question that Mr. Number or Johnny can jump in, but I want to ask Quita first. What exactly do you think you would have known before, you know, about your diagnosis or everything? What you thought you would have known before?
You know, that's a hard question. Maybe, like, you know, knowing more about breast cancer per se, because I had no knowledge about it. And so when I was diagnosed is when I, you know, started learning more about what that all entails, and like treatment and staging and all of that. So that would probably be what I wish I would have known, is more about breast cancer.
So, which leads me to my next point. I mean, to the nurses here, and Mr. Nangwe and Johnny, please jump in. Let's talk about some of the misconceptions, and you know, or just some, you know, just rumors or whatever we want to call it about breast cancer. Can you guys just educate us on some of that?
Well, you have a clear example. It's not only for older women. You can be young and have it. So you have to pay attention to your body. Sometimes your body is speaking to you. You have to take the initiative to evaluate. Okay? You have a boyfriend or a husband. But you know, those can help. And if you don't feel right, say something. Check it out. All right. The other misconception is for the men. Men think they cannot get breast cancer. That's a lie. You can get a breast cancer. Okay. So men too, if you feel a knot, you know, a lump, or inverted nipple, or discharge in your nipple, you better go check it out, because it could just be breast cancer. Okay.
Can I,
Thank you.
Mary?
Go ahead, please.
I'd like to inject in here. Many times we don't do because body image. We're so into what we look like. So body image and self-worth can be part of that misconception that I know something's wrong, but I don't want to do anything about it because I look a certain way. I want to look a certain way. And for the woman that had the double mastectomy, there are things that can be done to give you back that self-worth and that body image. But if they're not told that, then they think that, oh, my breasts are going to be gone. I'm not going to be a woman anymore. Nobody's going to want me anymore. And I applaud is it Quita? Quita. For what you said about faith. Had it not been for your faith, had it not been for the people that were surrounding you with the support, you would not have been able to get through what you got through. And I think sometimes that's our problem, in that we don't have a support system. And then we go looking for a support system, and that support system is not there.
Right.
Also,
Thank you.
to add to that,
So let me ask a question. I'm really a novice. Does cancer come up with pain? Is it painful?
Yeah,
it's usually the pain
I
is
mean,
later. The pain
Okay.
is usually later.
Yeah.
The pain is
Yeah,
usually
so-
later. That's why, most people, and this thing also, like you talked about, making sure you do your research. I always tell people, if you're going to do your own research, make sure you're researching reputable sites,
Yeah.
because there's so many things out there. There's so many people who call themselves health gurus, and so many things. Like this
Yes.
actress Ananda Lewis, who just recently died, she did her research too, and she said she wasn't going to have any of the traditional treatments and all. And by the time she got to where she was supposed to get the treatment, it was already too late. She did end up getting traditional treatment, but so if you do your own research, make sure you're looking at reputable sites. You're talking about the Susan G. Komen Foundation. You're talking about American Cancer Society. Like I said, Tiger Lily. You can go on there. Don't just go on there, because so many things on the internet. So many people on the internet.
True.
Is have health background and also. And then also the stigma to people saying, I don't want to do anything with my breasts. And it's you're not always going to feel a lump. People think you're going to feel a lump. Sometimes you don't feel any lump. You know what I mean? Until they do your traditional screening. And when they find out, then they find out that, something's going on. So you're not always going to feel a lump. All right. And again, like I said, the soft breast examination, you have to know how to do it. You want to make sure you're doing that like a week. If you still see your period, do it a week after your period and all that. And you're doing that, you're going to be going around with your fingers. All right. Going around the whole breast without your bra on, naked. All right. Don't let your boyfriend or husband do it, because they're not going to be paying attention to that.
They're not going to do it well.
Just making sure. All righty. So, you're going around. I don't know if you guys can see me clearly. You're going around all the way, doing your fingers and touching that, going all the way around until
like
you press the entire thing. So you have your hand like that. You get to your nipples. You pick your nipples and you kind of squeeze it. Sorry. I'm doing scientific stuff here, and there shouldn't be any kind of
No, we
drainage
need
or
it.
anything
We
coming
need
from
that.
there. Going under your arm as well, to go all the way back there, because you got breast tissue all in this area and all that. So you do that at least once a month. And again, like I said, and then also having a mammogram. They'll tell you, if you go in with 2, come out with 2. So most people get their reconstruction right there, right after the surgery. They get their reconstruction. So most people are saying, "Oh my God, it saved your life. Aren't you happy they saved your life? What do you want to get, a regular different breast for?" No, because it's a whole image thing. And until you're going through that and all that, or you taking care of, like someone like me who are taking care of patients like that, of course you want to come out, because you're going through so much, the hormones, the pain, all of that. At least coming back out and looking back as normal as possible. Again, that's all part of the healing process. So don't let anybody shame you and just saying, "Oh my God, why do you want to get a breast implant?"
We got to call. We got to
Yeah,
call.
we have a
Abby,
call.
if you don't mind, we got to call. We'll come back to you. Yeah.
Okay, go ahead, sir.
Yeah, my name is Sarah.
Can you all hear her?
Analyst on the show. Can you hear me?
Yeah,
I hear
they
her.
can hear you.
Okay. Yeah, I just want to say thank you, guys. This is a beautiful show. I am enjoying it. I'm following it. I'm at work currently on my break, but I'm following the show. It's absolutely a beautiful show. Lots of information. I want to say thank you so much to our survivor on the show, Quita. Your story is so amazing. It got my eyes watering. I want to say bravo to you. But my question here is, I feel so frustrated that a lot of us, we have these opportunities here because we are in a developed country, but our people back home don't have. So I don't know what we can do. Maybe I was going to suggest that we have like a 10-minute educational, program on the show wherein we can continue to, educate our mothers and our brothers and sisters back home to, for them to try to do some checking on themselves. I don't know what kind of impact it's going to have, but I feel we should do that. Maybe somebody will learn something and, it will help someone to save a life, because our people really don't have it. They don't have these, these things accessible to them. And some of them, like sometimes even here, when we are here, we go to the hospital and then they ask you, do you have a history of this or that? We don't know, because, we don't have back home, all of these tests done to know whether you have a family history or something. Sometimes I just say, I'm not sure. I don't know what my mom and dad had, stuff like that. But I'm just encouraging our government to do something, at least give our brothers and sisters, or at least, a physical every year so that they can go and get checked up. Thank you so much. I'm enjoying the show. It's a beautiful show. Thank you.
Thank you, sir.
Anything else somebody want to add before I throw a question or two?
I had a question. First of all, I had a comment, and this is Miss Simmons. She just took it out of my mouth. I had a question about body image and the perception. I know earlier before you all came on, Abby was talking about those who might have heavier breasts may pay a little extra for a mammogram and all that stuff. And I know she did explain what she meant, but I just wanted to make sure we reemphasize that, so that we don't leave the impression that those who don't have heavy breasts are, for some reason, at an advantage. And, if your breasts are heavy, then, you are at a disadvantage. The question I would like to ask is, can we talk a little bit about the recidivism rate? Because we're talking about misconceptions. I know when you go through the mastectomy, what happens? Is there a chance that you have a call? Okay, let's go ahead. Or is there a chance whether the cancer will recall? I just want us to talk about that. Thank you.
I can speak to the heavier breast. We're talking about, I think somebody else mentioned the pricing more. If you have insurance over here and your breast, you have the mammogram first. Like I said, sometimes I send patients to get their mammogram too. If they tell you mammogram. Okay.
Sorry, I don't want you. I know you in flight. We got a call, and then we'll come back to you, if you don't mind. Yeah.
No, go ahead.
You're on speaker. Just tell us your name and where you're calling from, and then you can go ahead and make your comment or put your question out. Can you hear?
Can you hear me, Tavina? Can you guys hear me?
They can hear you. Let me increase my volume. Yes, they can hear you.
Yeah. The show is very interesting. Let me introduce myself. My name is David Kessler, and Quita is my wife. And I just want to tell her thank you for coming on the show. Just a little piece for people to get and to understand. So when my wife went through the double mastectomy, one of the things that the doctor told me, the doctor told me that it's going to be very hard because she will never look the same. And in terms of sleeping in bed with my wife, the doctor told me those are the part that makes men to leave their wives. Because, we're all having breasts. Most men will feel that, they can have a woman. And the doctor told me it was going to be hard for me. But one thing I told my wife, I told her, I said, I will be here for you until you don't own me. I will stay with you until you say, I want to. So like my wife said, it's been 12, 13 years we've been together. And she has been a very strong woman in faith. And she has, done everything that, even with all the press, she still see herself to be very beautiful. Like I always say to her, she's one of the most beautiful women from Africa or in the world. I always tell her that. So you stay beautiful. So I just want to encourage all the guys out there, when your wife or your sister or sibling going through this thing, be strong in faith and be there for them.
Amen.
You know,
Amen.
when my wife was going through it, I was there for her.
Mm.
I did everything, you know, the matter of fact, we on the show, I want to say it to all the guys, and I was the one that even started encouraging my wife to have sex with me because I know it was hard for her, but I said, no, don't look at it that way.
Don't make your wife fall for the chair.
Man, let be so, man. Biggie, let be so.
No, this is a beautiful story.
Yeah.
Yes.
I talk
Everybody
about
need to hear it.
you know, intimacy and the chronic illness, illness. I talked about that.
Yes.
You know, as time went by, you know,
Mm-hmm.
she started getting to get back to herself. And at the time, our kids were very young, you know. I mean, the two kids, they're in college now, but at the time, they were very young. So it was hard for them going to school and seeing their mom the way she was looking.
Mm-hmm.
So I just wanted to come on the show to tell you guys thank you. And I appreciate the what you guys doing.
Thank you for being a good husband and a good father. We appreciate
Thank you, brother. Thank you, brother. I take my hat off for you, brother. Thank you.
Yeah, man.
Yeah. I be
What a
full.
great story.
I know.
What's up? Story.
What's up? I mean, how cool can this be? Beautiful love story, huh?
Yes. And I did
Yes.
I did do a show on, how to remain, loving and intimate in
Right.
Yeah.
That's a
trying to get
tough
flaws
one.
or any stuff like that.
That's a
Because
good
it's
show.
important. It's a
Yes.
team effort. And
Very.
people
Yes.
and if you don't have a good support system, makes a big
Yes.
difference in the recovery and the healing period too. So people need to understand that it's a team effort. So yeah. But I think we're talking about the dense breast. I say like most of the time for your mammogram, you have insurance and all that too. So you go for a mammogram. If your breast there's the particles in your breast. It's not necessarily how heavy your breast is. It's the particle in your breast. It's so packed together that the mammogram cannot see completely through it. All right, so they might say follow up with a digital ultrasound. So insurance pays for that too, because that puts you at a higher risk of getting breast cancer you get diagnosed later because the mammogram, the endomammogram, regular mammogram cannot see through it. So they have a higher density mammogram and also have the ultrasound to follow through. And like I said, if they need to, they can also follow up with the MRI. Yes, it's a little bit more expensive. You may have to pay sometimes a copay and all that too, but yes, you have to go through all that, but it's not necessarily a big breast, it's just dense breast.
Thank you very much for that clarification.
Also,
And when you're
let me just
younger, you have
add,
more dense breasts too. So
even
yes.
though we are in America, but some people still don't have insurance. Okay.
Yes.
The
Yes.
CDC has a national breast and cervical cancer early detection program. They can, if you file to the program, you have to qualify for it though based on your income, but they can pretty much do your mammogram for free or at a reduced cost. So
Yeah.
these services are out there if you want to take advantage of it. I know we don't have it in Liberia, but here at least you can try to seek out. If you don't have insurance or you don't have the money to do it, that should not deter you from going to have your mammogram.
Valetta, you were saying something? You wanted to come in?
No, I was just buttressing what he just said about those programs. And sometimes they do have those, like during the month, the breast cancer awareness month, they have like a bus that sometimes they take around in those underserved areas, and they do free screening for people too. So especially in America, like he said, so to just make use of those opportunities that are there to be able to get the help that you need.
So we're fastly approaching our time here, but I have probably one question for Quita, one question for you guys, and then maybe Mr. Number come in, and then we can wrap up. So for Quita, most times people think that, okay, I took everything out, so I don't have to do anything more. So what are you doing as preventive care after? And then I'll put onto it, and then for our nurses, people feel like I'm not menstruating anymore, or I'm 50, 60, so this is not my problem. So you'll be thinking about your answer why Quita is telling us about the preventive care that she's doing beyond her breath. I don't want to use your big medical term. I want to say two of the titty going out. Let's just make it simple, for our people.
Yeah. So like when you have a double mastectomy, right, most of the breast tissue are gone, but there's a chance that some of the breast tissue are still there. And so what my oncologist has advised is that I still like, check underneath my armpits, all the way at the back. And then since I've passed like my 10-year mark of being cancer free, I go every 2 years to my oncologist, and we do some blood work. And then also, I forget the machine it's like I think it's a PIP machine where they'll just do a full body scan.
A PET scan.
Yeah, so they'll do the full body scan. So that's every couple of years. So that's kind of what the routine is. So I still check my breasts, like the underneath my arm and stuff like that regularly. And then every couple of years I'll have that scan done. So you still have to check and make sure things are well and still see your doctor and all of that. Yeah.
So for nurses, like I said, no
So
period. I'm
the
60
question
years
you
old.
asked,
Uh-huh.
I think we need to be careful because I think the stats here is almost 270,000 diagnoses or cases of breast cancer every year, and about 42,000 deaths. So, with that being said, a lot of the numbers on there are people that are 50 and above. So if you think, say, you no longer have menstruation and you can just run free because you don't have the hormones,
Right.
that is so wrong. You
Right.
got to be careful. You have to take it seriously because that's even when you are higher risk.
Mm-hmm.
So
Yes.
Yeah. So I didn't even realize that even Sarah had called me. My people, I got message on my phone for like real people business. I took it off. So I see if you get my direct number, you will not be able to reach me. But yeah,
So
Go ahead.
Tell me, let me come in quick because
please.
I mean this program is so important. I'm sitting here trying to develop some kind of awareness program in my head.
Johnny,
Probably
I'm
after here through
I'm sorry.
working with
Let's take the call real
Let me
quick,
that
Johnny.
call.
and
We
you
can
can
call.
come in.
I got
Yeah.
another call too. After you miss the number, I have a call from Canada.
Okay, go ahead, Sarah.
Yeah, I heard Quita talking about some of the care she have to go through after she she being free from cancer and stuff like that. I want to ask, is diet part of that too? Because I have a friend who's battling cancer right now, and she's on a diet, and that diet is kind of really, really making a difference. So I don't know. I mean, I just want to find out whether that diet is part of, some of the remedy for that. Thank you.
I think Ms. Simmons alluded to that too, but thanks, Sarah.
Yeah.
Diet.
Okay.
Any of you can take it, I guess.
Diet.
Or you want to do the both questions together?
Yeah. Let me bring this one caller.
Okay.
Let me bring one. So you're on speaker, your name and where you're calling from, your question or a comment.
Thanks, Telvi. My name is SB Don. I'm calling from Toronto, Canada. I just joined the show about 10 minutes ago. I saw the flyer yesterday, the promotion for the show, but I knew I wasn't going to be able to make it in time because of my work schedule. But I just wanted to come on, first of all, to say thanks to all of you for such a wonderful show, wonderful discussion, something that is very important for our community. Most often as Liberians, we usually, have a reactionary tendency to our health, to pretty much a lot of things that concern our lives. And, we're not usually accustomed to being, taking preventative measure. For me personally, this conversation, topic at hand, discussion is very personal to me because, like my sister Quita, who I'm just seeing for the first time, by the way, God bless you. Your story is inspiring, and you seem to be a wonderful woman. Listening to your husband come on here and just share his thoughts, I think these are the kind of things that should really inspire people in our community. So I want to applaud you for, taking your vulnerability. I can't even speak.
Don't talk it to God. We'll put you on. They will clip that video.
But being vulnerable and coming out here and putting your personal life story, I think is something that we don't do often. For me personally, I lost my dad to pancreatic cancer, and just recently in 2015, and just recently last August, I lost one of my brothers to lung cancer. For his case, yeah, he was he was a early smoker. He smoked a lot growing up as a young person, all the way into his adult life. But for my dad, he had a triple bypass surgery years prior to when we found out he had cancer. So, we took him yearly for his checkup with his cardiologist, and his health, really started to deteriorate. And, people in the family were saying, oh, it's probably, issue with his heart and stuff like that. And with my background in pharmacy and working at Princess Margaret Hospital, one of the top oncology centers here, I had my suspicion. I wasn't sure, obviously, but I had my suspicion that, it could be something that was related to cancer. And my dad was very private with his health. Like, we would go to the doctor, and believe it or not, the old school parents, my dad would make you sit outside in the waiting area
Right.
with the doctor one-on-one. Yeah. So, but anyways, long story short, when we finally, got the news that he had, pancreatic cancer, we had to, of course, as family, put our arms around him and, just be strong for him until his final days. The same thing with my brother. He was a junior to my father. They looked identical, same height and everything. He never told us either. And he was extremely private with his health, with everything. Again, when we found out, we had to do what, every family would do and try to be there for him. But I just want to say, to all of the young people out there that, cancer has no boundaries, and it can come at you at any time. And so for me, I see my doctor twice a year because I know it's something that is within my family. And, I had a brother who's a survivor of prostate cancer. So, I have to go to the doctor as a young man, a confident young man, and I have to lay it on that bed. And the doctor comes in and play with my testicle, like the sister Adi was saying. You use the hand to search for any, physical signs or anything that may be unusual. So I'm a young man. This is probably the most uncomfortable thing that I do twice. I'm telling you, it's not fun. It really strips you of your manhood in some sense. But I guess with my background in healthcare and understanding what's at stake, I have to go there and, sit on that bed, take my pens down, and, the doctor come there and he would do, his normal checks. And I know a lot of, the young people in our community or just people in general, these are things that they don't feel comfortable doing. And we take it for granted. We sit home, we have a good time, we go out, we hang out with the boys, we hang out with the girls, and then we come home and do it all over again. And we need more of this show because these are things that are eye openers to our community and how you can take control of your health. A lot of times, Shelby, you see our exercise and I'll post a video online and people will come on there sometimes, they will joke around and say, oh, he's showing up and stuff. No, it has nothing to do with that. It's just one of the ways that we try to encourage people to take control of your health. Exercising is very important. Exercising helps, regulate the hormones and estrogens in your body. It helps boost your immune system. Little things that can help, prevent your body from fighting against itself. I think I heard someone asking earlier about dieting. Yes, dieting is also important. I tell people all the time, we have our foods that we eat as Africans, as West Africans, but sometimes it's also good to change your routine, your eating habits. Take certain things out of your diet. When your body would never lie to you. Your body would never lie to you. When there's anytime there's something unusual about your body, you would know. And I say this to people all the time. People will go see the doctor and they will come home from seeing the doctor and they will say, you know what? I still don't feel good. So then I will ask them the question, did you tell the doctor this or did you tell the doctor that? Most times people go to the doctor, they just sit there and listen to what he tells them and then they leave.
Okay.
And then they leave.
Oh.
So you have to be very cognizant of the signs that your body provides to you. And you gotta take the initiative to say, you know what, I don't believe everything is right. Because how I'm feeling or what I felt today or last night is it was something that I've never experienced before, and you gotta follow up on it.
Sure.
take initiative of your health, and just know that as you get older, your body's not always going to be the same. And so it's very important to always be on top of how you feel. If you see anything unusual or feel anything unusual, follow up on it. Don't take anything for granted. So thank you guys for such a wonderful, wonderful, wonderful show. We need this in our community. I hope, Telvi, this is something that you would do often, because I think it would help a lot of people. It would change a lot of lives. Thanks to all of you. Sister Ivy, I met you once in Philadelphia. You probably won't remember, but I met you once, and we briefly spoke. It was a pleasure meeting you, and I just want to say thank you to everyone else on the panel today who are here providing great information to people within our community, and God bless you all. Thank you very much.
Thank you. All
So are
right.
you a member of Abby Tyler's Healthy Living page?
Yes. So I think Sarah had a question about food and diet, and then if anybody want to add to what SB said, I mean, you guys have said a lot, and then we'll probably do closing thoughts. And I think Joni had a question before we even, but I'll let you guys go first. Let him address those, and Joni can come in, please. I think you guys talk about the food,
I think
right?
we answered that question with the weight and all that. Yes,
Okay.
diet, any illness.
Yeah, we
most
talked
of the
about that already.
illnesses, you have to regulate what you eat. It's not about what you eat; it's how much you eat. So if that can answer a lot of the questions, like the gentleman said, Liberian, we get caught up and we just eat it for life. You have to switch around a little bit, and if it's not working for you, try to switch it up.
Yeah.
You can also eat.
Go ahead.
You can also eat your Liberian food, but you can eat it, make it healthier. There are ways in which you can still make your Liberian food healthier and eat your food. You, instead of eating the rice every day, you can either eat bulgur wheat or switch it to something quinoa or something. So because the thing is, sometimes hard, but make little changes, and also you have to eat a lot of vegetables and stuff. It's not like you said it's how much, but it's also what you eat, because you will sit all day and just eat a pack of Cheetos or chips every day and expect you to be okay. You have to change your choice of food. You have to have more green leafy vegetables and more protein rather than eating like going to McDonald's or doing those kind of things. So that all can also affect your health if you do every part of your health, not only cancer, but also your heart health and everything else can be affected by what you eat.
Thank you.
And can I add this?
Go ahead.
Can I add this? For the people in Liberia, maybe it's a blessing because a lot of the food we eat in Liberia are organic. I think that helps a little bit. And again, our Liberian women do breastfeed. Here, a lot of people don't breastfeed. That's a risk factor. If you don't breastfeed, just to add that to the conversation. But that's a good thing that our Liberian women do breastfeed.
But not everybody, not all babies latch on to. So other people feel guilty about that. Not every baby can latch on to the nipple effectively too. So sometimes some people cannot.
We
breastfeed.
encourage it.
Yeah. So.
Joni, did you have a question for our nurses?
No, not really a
Nurse
question. I'm
practitioner.
just, I was just thinking.
Abby, smack me right on the head, please. Put me in check, please. Thank you,
I
Abby.
didn't say anything of that, but
No, please correct me. It's just so easy to say nurses. Nurse practitioner. These people work so hard. They study harder than even me. Hard. So please, I respect you guys. Thank you, Abby. Go ahead.
No, I mean, I respect all of them, and I was just thinking about all the things they're explaining. I'm sitting here. How can such very good information reach to as many women in Liberia, in villages and towns? I mean, I'm sorry I've been repetitive, but that's what I've been doing over the last 15, 20 years. So, and I've seen a lot of things that really bothers me. I don't have the means to help, but I always hope that whenever I have the opportunity to do such thing and find people that we can collaborate to make sure our sisters and mothers in the hard to reach communities have some information like this that will do more preventive things than curative, because curative is always is almost unavailable, is almost not present. But if they can do anything possible to prevent themselves, good. Even in the high schools, if we can find a way to have some kind of high school and cancer preventive or club for high school kids to begin to discuss it, have a small lecture book or Sunday guide that they will meet once a week and discuss what to do about preventing themselves and taking actions. I mean, it will help us in Liberia, while we're waiting for the big money to have more equipment in the hospitals. Because I know very well that all the hospitals in Liberia, in the counties, may not have the kind of equipment that we're talking about to diagnose, cancer and the rest of it. But we can be more preventive. So thank you all. You guys are patriots. You guys are nationalistic. When we come to talking about nationalism and being patriotic, I think the health workers are the ones that we must also always see as the most patriotic and nationalistic people in the world. So thank you so much. I appreciate you. And I hope that through you, we can work up something, if it's possible, and with some high school kids in the interior in rural parts to begin to get educated and be aware of their body and their body work, how they can prevent themselves from coming in contact with cancer, or how to do things to like prevent themselves and the rest of it. But I appreciate this program. Hope we can talk more about this in the future.
So Johnny, not through me. Contact the nurses. You know, the nurse practitioner. Abby, slap me, please. Contact our nurses and our doctors.
No, in fact, I'm going to find Abby. I'm going to find Abby on. Yes, I'm going to find Abby on YouTube.
Yes,
and Abby, by information, if I see on YouTube, I see some good information. I will have to take it from there and see. When I get out to those communities, put on my computer or something, they just watch you, see you. Maybe if your language is a little bit difficult for them, I can try to interpret it.
No, she breaks it down very easy.
If it's possible to take your YouTube, that in that kind of lecture, I will try my own way whenever I'm among some group of young people, whether women or men. I can share that information with them. If you allow me to do that, I will let you do that.
Yeah, sure.
Yes,
sure.
yes.
I appreciate that too, and humbled by it. But the only thing about it is, like, when it comes to healthcare, you're not gonna get a lot of people watching. If I'm gossiping, talking about somebody's different thing, relationship and all, you have like
sure, you're right. You're right.
All that too, and there's nothing wrong with that. We should, it's good to have entertainment, but it should be a balance.
Yes,
so you can watch both. I watch the shows too, but it should be a balance. That's something that directly affects your life and all that too. So, but yeah, sure, please do.
So Johnny,
please do.
What I was saying, Abby, please drop your link in the thing that. But a lot of people know about your show. I know I share your show a lot. So even share in our local library community organization, a WhatsApp group. So drop your stuff in there. So if you don't mind, just one of your shows, and they can follow your YouTube channel and your Facebook page. The bridge already been established. You're here. That's how we network here. You share a space with people, and next thing you'll connect on LinkedIn, you'll connect on Facebook, and you start building this connection journey. And so these people got their own. Most of them got their own organization. They're doing these things. The community at work and every place. Faletta, got things going. Topa, he does a lot in the Liberian community. He's in the community with me. Probably 10, 12 years ago in church. But he does a lot of things with Liberian Nurses Association. Sometimes I always say he's the only man among all these women all the time talking about, community health and when they're doing walks. All the time I see Topa, I want other women walking. He would never say, I'm busy, I'm going to drink liquor with my friends. He's always in the walks. Every time I see those pictures, Topa the only man among those people. So, and then follow him too, follow the Liberian Nurses Association. And Topa, now I'm talking, he fell off, but I want him to come back, because I know they got a program coming up soon. And probably part of his closing remarks, I wanted him to talk about his upcoming program. But when he come out, he will talk about it. But okay, Abby already, okay, they already shared it. I will drop it in the chat. But Mary, I know you talk about the spiritual aspect of the care and all of that, and Peter talked about her faith, that some of the things. But most times in our community or in the Black community, people feel like, oh well, if I got faith in God and I trust my God, He's a healer, He's Jehovah Rapha, I don't need to take no chemo, no any treatment, no treatment. I just need to rely on God. So can you all speak to that? Do we need a combination, or we just need God and God will do it all?
We need awareness.
Mm-hmm.
We need awareness. And Abby, I'm sorry that I don't call you an ARNP. I'm not an ARNP yet, but I do have my master's in health service administration, and I am a doctorate of evangelism, and all of those things in the spiritual right now for me. It's all about helping people to understand that your body is a temple. And if we don't take care of our bodies, we don't take care of the temple is going to fail us. It's really going to fail us. And no, we can't pray it out sometimes. You know, prayer is essential. Prayer is the key. Apostolic prayer is what we need many times. But people have gone home. They've been healed as they've gone home to glory. You know, and so we try to counsel them and we try to support them to let them know that you do all that you can do and God is going to do what he's going to do. But it has to be a partnership.
Yes, yes. That's all. It's the whole team, the whole health team, the dietitian, the holistic person, the pastor, chaplain, all of that. It's the whole team that takes care of the patient. And I also did a show that said, can faith and medical science coexist? So when you go my stuff there, if you don't see the videos on my page, Facebook's moving them. So it's on my YouTube page under the same name. Okay.
Okay. Thank you.
Okay.
Let's wrap
Tell me,
up.
Mr. Miller's in the back. I think we should run out now. So we
need to wrap up, but I wanted Mr. Miller to come in and talk about
He's in the back.
Yeah, you know, I don't have admin access, so if you do, then bring him
All
out.
right.
Otherwise, let Mayan bring him in.
Okay, Maya, if you can hear us, we have a guest in the back, please. All right.
But while we're waiting for him, I mean, other people can give their closing remarks because we're wrapping up now. Anything else you want to share, including part of your closing remarks, you can talk about you got upcoming programs, you have a website, you got a channel like Abby. Bring it all out. You know, this is your time, you know, to just bring everything out.
Okay.
Anybody can go first. It doesn't matter.
Quita, you want to go? I think you're muted.
Sorry, I thought I was unmuted. Again, I just want to appreciate you guys for allowing me to come here and share my story. I just want to encourage anyone that's going through breast cancer. You know, in our Liberian community, sometimes when these things happen, we feel like, shame, a lot of shame surrounding it, a lot of isolation. Just remember, this is not something that you looked for. And don't be afraid or ashamed to talk to people about it. It's a very isolating disease in itself. So the more you can come out and live your life, don't allow cancer to stop you from living. Still live your life and be able to associate with other people and share your story. I just want to encourage anyone that's going through it to let you know that your test is bigger than the testimony. Your testimony is bigger than your test. And so that's all. Thank you.
Thank you.
And I mean, you guys can follow Quita page. Quita doesn't do a lot of Facebook and all social media. I literally had to drag her on this, beg her husband, to do this. So this is not her thing. We didn't want in Facebook noisemakers, but if you want to connect with her, just follow her on Facebook. Yeah. Thank you, Quita. We'll talk offline.
Yeah.
Take care, everybody. Bye.
Thank you. Thank you, everyone. Thank you so much. All right. Have a good night. Thanks, audience. Thanks for joining us. Let's do it again.
Okay. Well, the other people didn't wrap up. They didn't get their closing thoughts.
Oh, they didn't? Okay.
No, they didn't.
Okay.
So who didn't?
Abby and Mary. Abby, I'm dropping your link here in the show. Your YouTube channel. I'm trying to find it. I think I got it now.
Yeah, and the same thing. Yeah. Oh well.
My closing thoughts go back to and the whole person, the body image, the self-worth, looking at the physical, social, emotional, and spiritual, because as it's been said, it all works together. And so once that you have been diagnosed, your faith, your personal relationships, support groups, and restoration, and having, and I applaud Quita's husband for coming on and saying what he did for her, because not every woman has that. And so hopefully some people in Radio Land heard him and say that I'm going to step up if they're in that situation. I see that I need to step up. Thank you.
Thank you. Alrighty. My closing, like I said, thanks for having me on the show. Is there a call, Talvina? Okay. Alrighty. Just gonna end it because this is awareness. Benefits of early care. I'm just gonna go over a couple of points here. A benefit of identifying breast cancer in its early stage often provides a wider range of treatment options, including less aggressive interventions and increased chances of successful outcomes. It improves your survival rate. Early detection is associated with higher survival rates. In one study, annual mammograms starting at age 40 show a 40% reduction in death from breast cancer and minimize treatment intensities. Early stage breast cancer may require less extensive and less aggressive treatment. And to finish up, preservation of breast tissue. In some cases, early detection enables breast conserving surgeries. For example, the ability to remove a lump instead of doing a mastectomy. Okay, so again, speak to your doctor, go to your doctor every year like you're supposed to for your primary care. For women, start seeing your OBGYN, that's your, gynecologist. You start seeing that at age 21. They'll do your breast examination while you're there too. They'll teach you how to do breast examination. And of course, a follow-up, age recommendation, know your family history, alrighty, and then follow up from there. And also follow Abby Tyler's Healthy Living for more health information. I come on Tuesday for our longer show, and I do Abby's Daily Dose once or twice a week. Okay, so once again, thanks for having me, and I look forward to coming back again.
So we have Mr. Miller on the phone because I'm not able to bring you on stage, but I don't have admin access. So he will just call in with his closing remarks. Go ahead, Tupa.
Thank you, Tavina. Just wanted to encourage everybody. This is a good awareness, especially for those of us who are privileged to be on this side of the world. Nothing should stop you from going and testing every year, doing your mammograms and staying on top of it, because you never know. It could be one thing in your life. It could be just that one visit that make a difference in your life. Survival rate is high, but it's with early detection. So if you don't detect it early, you might be part of the statistics. So you don't want to do that. You want to get it early so it can be treated early. But just to close about the organization, I am a member of the Liberian Nurses Association in DFW. We've been undertaking projects in Liberia, and we do have our 11th anniversaries coming up on November 22nd. We're encouraging the community and those in the diaspora. We have a webpage, it's lnadfw.org. You can get on there, you can donate. If you're in the local area, you can attend the program. Like I said, the project is, we are taking on a project for the maternity unit at Phoebe Hospital. Our goal is to raise at least $14,000 to $15,000 so that we can be able to renovate the entire maternity wall. And we've done projects in different hospitals across Liberia. This is about, I think, our 5th hospital now that we are helping. So we are a little group, but we are big. We have big hearts. So we're trying to get everybody on who can help to promote this. Somebody cut me on.
Yeah, they brought you. Yay! Now the people can see who's talking. Yeah, we can hear you. And Valenta is back too. Yes. Yay! I got admin access. Otherwise, I would have brought you. But we can hear you now.
I can hear you.
Oh, man.
Can you hear me?
We can hear you.
Just give me thumbs up. If you can hear me, I'll just continue to talk. Mm-hmm. All right. Yeah. So we're encouraging everybody to grace the occasion so we can run it.
Bad connection.
It's in Liberia. That's what we do this. So just encourage everybody, come out. I'll post the flyer up there on Facebook, and we do have our own webpage, like I said, lnadfw.org, and there's information on there. But we're in the DFW area, so we'll have it this November 22nd. Come up and support the group. Thank you.
Thank you. And y'all follow him too on social media. Follow that. I see a turn. Everybody go on.
Okay. So I just want to say thank you so much, Telvi, for having me on and the rest of the crew. This was a very good program. Mm-hmm. And also say thank you to Quita for her story, for sharing her story. That was really great of her to come on and be vulnerable to all of us. So just closing that we should just be able to know our bodies as women. Also, as be vulnerable to all of. So try to curtail those things that cause us to be having those stuff that will cause us to have cancer or also put us at risk for cancer, like tobacco, cessation, alcohol, trying to eat right and trying to do diet and exercise. I know sometimes it's hard to do with our lifestyle, but just a 30-minute walk or a 15-minute walk a day can be your exercise when you do it. And also to just be aware of our bodies as women, like do your self-breast exam and be there. I don't have shows, but I'm always willing to participate in some of these programs if you guys need me again and again. Thank you so much, and I hope you all have a great evening.
Thank you, Valeda. And yeah, please follow her on social media. She's not noisy like us, but yeah, follow her. Mr. Norbert, take us home.
Thank you very much, everyone. I much appreciate it. Let's do it again. Good night, everyone.
Have a good weekend.
Thank you. Good weekend. Happy belated birthday, Abby.